Thank you very much for your invitation. We have not yet performed any national survey in Korea, so I'm sorry not to be able to tell the exact instance or the prevalence of LH1 in Korea. Based on Japanese national survey, the prevalence of LH1 in Japan was estimated as 1 out of 50,000, and the total number of LH1 patients in Japan around 2,500. Considering the population of Japan versus Korea, we assume to have about 1,000 patients. There are 210 patients registered at my current hospital and 70 other patients at my former hospital. There is the LH1 patient community in Korea. Approximately over 100 patients or family members are actively interacting through an internet community. Let's move on to the current practice in Korea. After we found the mutation, we advised the patients to quit smoking. I once reported LH1 occurring after taking ethambutol for tuberculosis. Thus, I usually tell them to be careful not to get any infection, just like the COVID period. I also told them about the danger of taking any medicine. If they need any medicine for a period of time, I recommend them to visit us to verify the danger of the drug, which may keep them from taking any unproven medications. Finally, we recommend taking idebenone through internet purchase. I also explain about Rexone and its price. If they want to take Rexone, I give them a prescription and medical certificate to help them to get a reimbursement. Until last year, patients get Rexone through the Korean Orphan and Essential Drug Center, but now they can get it at the drugstore with a prescription. Regarding the major barrier in the diagnosis and treatment of LH1, it is not difficult to perform a genetic test in Korea because the Korean National Health Insurance covers the fee for the test for LH1, and we have a few very reliable test centers in Korea. When LH1 is suspected, we usually perform a basic genetic test for the 3 primary mutations in the first place, which cost $21 with Korean National Health Insurance or $35 without insurance. If there was no common primary mutations, then the next step could be ND1, 4, and 6 sequencing, which cost $80 with insurance or $135 without insurance. If we find no mutation with ND1, 4, and 6 sequencing, then we order mitochondrial gene panel, which costs $430, about 3,021 Chinese yuan. As far as barrier is concerned, the main one would be the price of Rexone. 180 pills of Rexone for 1 month cost 7.5 million Korean won. At this moment, the drug company is returning 3 million won. Therefore, a patients need 4.5 million Korean won, about $3,500 at this moment. Some people go into debt to buy Rexone and sometimes even sell their houses. Even more tragic is that taking Rexone for over a year would not improve visual acuity in most of my patients. Another challenge is that we do not have any center for gene therapy in Korea. In addition to that, the cost of gene therapy would be another big hurdle for them. Various studies on gene therapy for LH1 are underway. Both Neurops and GenSight noted bilateral visual improvement with unilateral treatment. GenSight found visual improvement even in patients with a longer period of vision loss and a larger treatment effect for bilateral treatment than unilateral one. More and more data about the treatment of LH1 have accumulated. Thus, I hope gene therapy could be helpful for the patients, their families, as well as us, eye doctors for them.